I'm Gloria Elliott. I'm the program manager for BoSS, and I'm thrilled that so many of you made it here today. I had the opportunity to get to talk with a lot of you in sidebars already, and your enthusiasm for this program is palpable. It's exciting. I can't wait to work with you. So I'm really looking forward to hearing more of your ideas today, and just looking for opportunities to team and get your teams all fully fleshed out and then tackle this problem. So before we dive in, I want to give a heartfelt thank you to the enormously deep team of people I have behind me, far too many to name, but I do want to call out my core BoSS team, who some of you have already met as well. We have Annie Bowles-Welch, my right-hand technical CETA, Johnny Harris right next to her, the business financial program manager, business financial manager, rather. And then I have Katrina Lim and Sarah Nycom, who have provided incredible surge support as we built this program out. This program truly wouldn't have reached this day without them. So a quick word about today's agenda. Think of it as a roadmap because we're already off schedule. So it is not a rigid schedule. The timing is approximate by design. Today is about you and getting your needs met. So our goal is to drill down into the nuts and bolts of the program and equip you with the clarity you need to bring your very best solution summaries in next month, just a few weeks from now. We also want to make sure that everyone, whether you're sitting in the room or joining us online, has an opportunity to ask questions and get to the details that you need. So we have close to 200 people tuning in online. So we're going to be driving all of our questions through the portal today. So we're not really going to do live Q&A. We want to make sure we get you clear answers and that everybody has an opportunity to get their points in. So QR code is on the agenda. It's all over the room. It's over there if you need it. You can go to the BoSS website and find it. But yeah, feel free to keep funneling your questions in there. I've got a team of people who are watching for those questions to come in. And then at the breaks will be coming up. Someone from my team will be coming up, either myself or some of these folks, and answering your questions as they come in. So let me walk you through how the day is going to unfold. We're lucky to have some folks here from our leadership team today to set the tone for how we operate at ARPA-H and what it means to enter the ARPA sphere. So the mindset, the pace, the ambition that we expect when we go after transformative health solutions. After that, I'm going to hand things over to our moderator, Isabella Howe. She's going to save my voice for the many, many sidebars I have this afternoon. So Isabella is from the Division of International Affairs, and she'll be taking us through some of the housekeeping things and anything else that comes up throughout the day. So then I'm going to return and talk to you about the what, when, and why of the BoSS program, what we're trying to do, why it matters, and how we think this community is uniquely positioned to make it real. Not in 10 or 20 years, but in 4 really fiercely focused years. So by the end of 2030, we're going to be looking at a completely different picture than where we are today. So from there, Andrew Stark from our contracting office will walk you through the details of the proposal process, the teaming, the contracting, all of those details. So I know we've already had a lot of questions trickle in on that. I would ask if you still have a lot of questions on that, wait until Andrew fills you in. He's going to get into nitty-gritties of contracting. And if you have questions after that, fire away with the QR code. Then we're going to hear from Amy Lynn from our international office on forming international partnerships. And once we set that foundation, the focus shifts squarely to you. The afternoon's all about you guys and what you need to be successful. So we'll kick off the first round of lightning talks late morning, really high energy snapshots of ideas and capabilities. Hopefully that sparks some connections and gets you really excited as you go into lunch and use the lunch hour to maximum benefit, to network and flesh out your amazing teams. Okay, so I think that those are the main things I wanted to get out there before we bring up some folks from our leadership team. To officially kick us off, I'm delighted that we have our new director, Alicia Jackson, with us. So Alicia joined us exactly 101 days ago, and she has been turbocharging everything since she walked in the door. So one of the first things we had to do as PMs is sit with her and do a 1-hour deep dive on our programs that we're ready to launch. And so it was a little nerve-wracking for all of us, but I got to the end of my presentation and she said, wow, this is going to be really hard. And then she said, but we should totally do it. And that statement really speaks to her attitude. Like she just has a real appetite for tackling hard things. She has the same redheaded impatience that I do. I've heard her say many, many times in the last few months, why are we doing it this way? Why aren't we doing this faster? Why is this taking so long? So things are going to move fast, I think, now that she's here on board. I'm inspired every time I hear her speak. I'm so motivated. I want to leap out of bed and get to work on things. And I'm sure she's just really exciting to work with. And I'm happy to be a PM during her tenure. And I'm sure you'll find her exciting as well. So with that, our new director, Alicia Jackson.
Thank you. Thanks, Gloria. Thank you. All right, well, that was an incredible introduction by Gloria. And I gotta say, she's really what makes it very, very fun to be at a place like ARPA-H. It's really the program managers. And Gloria's exemplary at what makes a phenomenal program manager, right? She spent her career in a bunch of different positions, always laser focused around the same problems that drive mission and drive what ARPA-H drives. She comes with a ton of energy. She knows how to lead. She knows how to speak well and communicate. And she's not afraid, like we discussed, to do the hard things in order to get to a great outcome. There's really very few places in the world that can do the things that an ARPA can do. It's really DARPA and ARPA-H and some of the other ARPAs that can be structured to go after things that just have incredible risk that really do seem quite impossible. And to be able to act like a time machine and compress the time to get to something that feels 30 or 40 years away, if at all, and think about how we could make it happen in years, not decades. That takes a lot of hard work. It takes ambition. It takes understanding what are the risks, what are the hard parts, what are the things we can do to test and see if we can get ahead of some of those roadblocks, how are we going to maneuver around them. Nothing will ever go perfectly, but half the job is just being able to pivot around those. And the key to that is everyone in this room who are the performers, the people who are actually doing the work, proposing how we're going to get there, thinking about solutions, thinking about, oh my gosh, this one's going to be really hard. Let's have two approaches. How are we going to tackle this one? How do we actually tackle it first so we know if that's going to be so hard that we're going to have to spend extra time on it or recruit expertise, et cetera. So every single PM takes a similar view as Gloria at ARPA-H, which is they come here, they have a burning passion, a burning vision, one that they've probably been told, you can't do that, that's too hard, that'll take too long, this isn't the place where we do things like that. Well, why don't we fund like a small grant first and see what happens, and maybe 4 years later, then we can talk about it. That's not how we operate here. We have a really unique ability to not only take a very significant amount of resources and put it towards a problem, but to be able to do it very quickly. This didn't happen by committee. It's not like Gloria got all the thought leaders together in a field and said, well, let's talk about what we could do, and we'll go around the room and everyone will give their opinion and we'll finally get to consensus and then we'll do it. This was Gloria talking to everyone in the field and then honing her vision, her idea, and saying, I want to do this. She decided to do that. She pitched it up at ARPA-H, and that also wasn't a consensus decision at all. This agency doesn't run on consensus, and that's why we can do both things, and a lot of times people are going to disagree or be uncomfortable about the things that we're doing. I'm sure there are people out there right now saying, Why are they wasting their time on this? This isn't going to work. This isn't going to happen. That happens all the time. And thank goodness I spent, over 5 years at DARPA, both as a PM and then a deputy office director there. And I did see things that people said would never happen come true. So I know it can happen. I've seen it happen. And I'm really thrilled that we can make it happen here. How many people in the room here have ever worked with an ARPA? Maybe a DARPA, an ARPA-H? Oh, wow, quite a few. That's incredible. So all of you know you're going to have the best time of your life over the next several years. It is like the gateway. The gateway drug is the first program that you work on. And then you're like, why am I wasting time on anything else? Because you do actually get, we want to give you enough resources so that you can just drive hard. I don't want you spending your time, we don't want you spending your time, writing another NIH grant, quite frankly. Spending all that time for maybe a few $100K. We want you purely focused on this. We want you to have the freedom and flexibility to go find the best people in the world to work with, to bring to your team if you're building a team, to go recruit people if you're doing that, to give yourselves the freedom and the flexibility to think about this only. We don't really want you thinking about anything else. Maybe your families. It's a joke. It's a joke. What's really unique about this program in particular is my PhD was in material science and engineering. And so when Gloria told me about the program, I fell in love immediately from multiple angles. One is it's a giant problem, cold chain stabilization. And with the advent of cell and gene therapies that are coming out, it's only a growing problem. And these therapies are very expensive, and a lot of that comes from the logistics around them. And we even saw this during COVID-19 with the release of the mRNA vaccines that needed the -80 freezer. So we all understand the issue. What I think is really bold about Gloria's approach is she's saying not only do we want to skip past just being able to be in cold storage, not ultra cold, we want to see if we can push it all the way to ambient temperatures, room temperature. That's a very bold bet. But what's great about that bold bet is that we're at a really unique time as well in science, and especially in material science and chemistry, especially with an advent of much of the kind of computational tools and AI tools that you see coming out. So it's a very exciting time in this space, in material science, in some of the approaches that we can take, and especially as well as looking at these extremophiles and looking at how they're able to stabilize at ambient temperatures over long periods of time and then reanimate. So it's a convergence of many things coming together right now. And that's really a perfect time for us to come and see if we can make a big dent here. That's one of the things that we like to talk about at an ARPA, and especially when I was at DARPA, which is, are you going to make a dent in the universe by what you're trying to do? And if you're not, what are we doing? Why are we here? Other people can fund things that are lower risk, whether lower technical risk, lower regulatory risk. Very few people can take on all those risks at once. VCs can't do it. They're looking for a return over the next 10 years. They need to return that fund 3 to 4x. I don't think anyone thinks that a VC would invest in this and expect a 3 to 4x return over 10 years, or even that this might 100x over the next 3 to 4 years, because it is a very hard technical problem. And so it does need a different type of investment, and an investment that we can actually bring to the table to focus on this. I'm really grateful both to Gloria and for all of you for coming today. I know it's hard coming through the snow for those of you who traveled from afar. I'm really happy for the 200 plus people who are showing up online, because the only way we get this done is having all the performers, all the great minds come together and say, raise your hand and say, yeah, I want to work on this. This is important to me. I think I have something to contribute here. Even if this may not be your sole focus that you've been working on for your entire career, we want to see people come from other fields and say, hey, I know something from over here that I think can come play. A lot of the big breakthroughs actually do happen at the intersections. I found that when I was a program manager as well, that I love bringing together teams where you might have somebody from control theory, biology, genetics, sometimes even physics as well, and bring together to build new tools and new ideas, new structures, just from that cross-pollination. And so I really want folks to understand that even if this hasn't been your sole focus, there's really interesting opportunities to come from the outside, or to build teams that have a lot of multidisciplinary expertise here and see what you can do. This is the opportunity to do that. It's not only an opportunity for us to think big, it's an opportunity for you to think big as well. Now, as Gloria knows, and everyone else who knows when I show up to these, the best job really in the world is to be a program manager. I know you think you're a performer and you think, this is the best job in the world, but I want you to know that every one of you, when you come and engage with us, you're now up to become a program manager for ARPA-H. If you also have a burning vision, if you think about something day and night, you fall asleep, you think about it, you've been dying to solve this problem for a long time and you think now could be the moment, this is the place you want to come. There is nowhere else in the federal government where you will be able to move at this speed, very low bureaucracy, not have to go through committee, through committee, through committee to get your idea to the top of the list and be able to go run at it. You have the ability to drive a field, to build a breakthrough. And it takes a lot of courage. It takes the ability to understand risk. It takes the ability to bring together incredible people across the room. It takes the ability to manage and work with them together. When you work with Gloria, you're working as a team. A PM really is a team leader in the end. She's going to be sitting side by side with you, working with you, checking in. One thing we always like to say, no surprises. The worst thing a PM can ever have happen is she shows up to a performer kind of review where everyone got together and somebody says, oh yeah, that didn't work. But you didn't tell her like weeks ahead of time or months ahead of time. That usually ends up results in you getting cut from the program. It's much better that she has a heads up because she actually doesn't want to cut you. She wants to work with you to figure out how this happens. This is why it's so fun to be a PM, is because you actually get to go work with the best people in the world to make something incredible happen. You come for only a 3-year term. It's not that long. Sometimes you get re-up for another term, but typically no longer than that. You're really in and out. We're not building empires. You're here on a mission. You're here to get that mission done. And then you're here to go on to other things. We had people come from academia. I was just catching up with an old friend of mine who was a PM when I was there. He's a professor at Pitt. And he said this transformed his career. He was known in his field, but after that, he went back and he said, my career is completely different now. I have so many more connections. I've broadened my expertise. He's never enjoyed being a professor more than since he got back from being a PM because of how much it taught him also leadership, management, communication skills, and the fact that it's broadened his research scope. If you're coming from industry, again, it's a great place to go, almost stretch yourself, build something, push this field forward. You can always go back to industry. You can go build a startup afterwards. You can become a VC. This is a great position for somebody who's often kind of a little, I don't know, they have the itch all the time, right? You're doing the thing, but you're always thinking about the next thing. You like jumping from one thing to the next. I don't mean mercurially, but literally you like to have an experience, then go to the next thing and see what might be out there. If you think that could be you, this is the place to come. We are hiring, we are looking for incredible people with incredible ideas, who are always pushing the limits and that they want to come and build something great and work with an incredible performer community like this. Thank you all for coming. I'm thrilled about this program, really thrilled, deeply interested, not only from what it can accomplish, but also in the science and technology that will be built. So I'm very excited to hear the updates from Gloria. I'm excited to see what you all are going to build. Thank you for coming and enjoy the rest of the day.
So next I'd like to introduce someone who has been central not only to BoSS, but to how we build programs and people at ARPA-H. So we have with us Dr. Blake Beckstein, the Deputy Director of Scalable Solutions Office, which is the office that I hail from. And I actually first met Blake when I was applying to become a PM. That's what we call program manager, PM. I later learned that he's known internally as the PM Whisperer, which tells you something about both his experience and his ability in helping shape bold ideas for programs and also shaping the people that have to deliver those programs. So today he's going to share a bit about the Scalable Solutions Office and how BoSS fits into the broader office mission.
All right. Well, great. Yeah, thanks everybody for being here. I'm Blake. I was formerly a program manager at DARPA, a couple of leadership positions. So I was glad I was here listening to Alicia, so I didn't say exactly the same thing, because I am as excited as she is about what we get to do in the ARPA sphere here. And I'm also excited about this program. And Gloria's not wrong. I also have been in charge of the program manager pipeline at ARPA-H for the past, I guess, 2.5 years. And some of Gloria's team members actually are in that area too. So if what Alicia was saying resonates with you about being a PM, there's a bunch of people here that you can talk to, and we'll give you information on that. But this program, I told Gloria as we were getting ready to get started, this is my favorite program at ARPA-H. And it's not because I tell that to every program manager. When the other program managers aren't around, I did say don't say anything to Kate or James or anybody else. But it really is. It's true. Gloria and I started talking, gosh, 1.5 years ago, 2 years ago, and I immediately thought we should hire her, right? She is exactly what this agency needs. The program that she wants to put together in Scalable Solutions, the office where I sit now, is very representative of what we are trying to accomplish. We want to have these things that are agnostic of what the end target is, but we want to solve the problems. I think of it as building the machines that make the things. And what she wants to do in BoSS, what you guys are going to accomplish through this program, give us that ability to change not just cold storage, blah, 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 but all of these fields that can be pushed forward and change the way that things operate. So it's such a perfect representation of what we want to do in Scalable Solutions to really solve big problems. And then, like Alicia said, it's an ARPA project. And that means that we're going to provide the right amount of funding to actually accomplish it, right? We're not going to, hold you back by limited funding and things like that. And we're going to be very targeted. I saw a lot of hands go up when she asked, who has worked with ARPA before. When I was a DARPA program manager, I used to say, it's good money, but it ain't easy money, right? I would have monthly meetings with every one of the teams that I was funding, and I would say, what did you do the last 4 weeks, and how are you going to spend my money, the taxpayers' money, the next 4 weeks? Should we continue or should we not? Are we making progress? So when you send in a proposal, when you are selected, just remember, this is going to be a grind. But at the end of it, what you accomplish is amazing, really amazing. So I guess I should talk about the slide. This is how ARPA-H works as we go through the process. The only thing that I'll really point out, I think the slide is actually kind of wrong because the performance piece is just this one little thing. That's actually the thing, right? Doing the program and getting there. So, well, I will tell you a couple of little things about ARPA-H. We have 4 technical mission offices. Scalable Solutions is one of them. And we're built in the model of DARPA. And you'll see a lot of old DARPA people at ARPA-H because the build of the agency is following, sort of that same idea of how to do advanced research projects. And one of the big pieces here, the solicitation, which is the second circle, Gloria and her team have thought a lot about this. I should also tell you, I used to be a professor, and I can't tell you how many times I had to say, it's in the syllabus, right? This is the same thing. Gloria and her team spent a lot of time putting together the solicitation, talking to experts in the field. My guess is she's talked to almost all of you previously, right? As she was developing the program and thinking about what the steps are that are needed to get where she wants to take it. It's in the syllabus. So as you go through the process of putting together your proposal, just remember it's in the syllabus. Make sure you check back to what she is asking you to do and follow the roadmap, right? You were pretty thoughtful on putting that information together. So I want you guys to get on with the day. I know Isabella is going to be your MC, and one of my favorite people at ARPA-H, so you guys are lucky to have her here right now. If you guys weren't here, I would have said she's my favorite. But use the time today very wisely. For those of you that are online, pay attention. Don't be doing other things while other people are talking. Like, actually pay attention. For those of you here in the room, talk to each other. Some of the best connections that you can make when you want to get involved in an ARPA program is actually interacting with the other people. Maybe have different skill sets come together, have those conversations. Make sure that you use not just Gloria's time wisely, but you'd be surprised at how wise on what the program is. Her team. In my case, when I was a program manager, probably better to talk to my CETAs than to talk to me because they knew so much. So talk to these folks. They are going to be very helpful. But I want you to get on with the day. I want you to listen to Gloria. And this is, like I said, my favorite program. So I'm excited that we're finally here. So Isabella.
Yep. Good morning. As Blake mentioned, I'm Isabella. I'm on the international team. I cover Asia Pacific, but I've also been search supporting Gloria's program these past couple of months. It's great to see you all in the room and to have such great representation online as well. We have a wonderful slate of speakers, all of you in the audience today, and I'm excited to be the MC for today's PD. We have a lot of acronyms at ARPA-H, Proposers Day. With that, I'd like to introduce the BoSS team. So you've already met our indomitable program manager, Gloria. She will be back on the mic shortly, so I'll jump into introducing the folks around her who make it all possible. So first we have Annie. Annie is a cell and molecular biologist and bioengineer with experience focused on cell therapy manufacturing. Hi, Annie. She's also a former CMC reviewer at FDA's Center for Biologics Evaluation and Research. Next, we have Johnny. Hey, Johnny. Johnny's a business financial manager with 28 years of experience in DoD acquisition programming, financial management, and contract administration. He provides financial and contractual support to all of Gloria's programs and projects. As I mentioned, I'm your MC for the day, as delineated by the little microphone. I like that little icon. Please find me with any questions that you have on the schedule as we move throughout the day. Please don't ask me any programmatic questions. The brain power is the team, not me. But I do have the QR code on my phone background if you lose your agenda. Next, we have Katrina. Katrina is a program analyst with experience in statistical analysis, data modeling, supporting the BoSS program with program evaluation metrics and impact assessment models. Next, we have Sarah up in the front. Sarah is a natural connector with deep talent acquisition expertise and has supported Gloria and the BoSS team through academic and industry engagements. She'll also be helping facilitate sidebars later today, so if you have one, you'll look for her. And finally, we have Andrew Stark against the wall over there. He's an agreements officer in the Business Innovation Division, supporting BoSS program, and he's responsible for negotiating, awarding, and administrating agreements that enable programs and projects at ARPA-H. You'll be hearing a lot more from him later. And that's all. So we'll move on now to actual programming, and thanks for bearing with me. Over to Gloria.
All right, so let's get into it. So a little bit about my why before we get started. I grew up very rural. I grew up in this little island off the coast of an island in the woods by the seaside. And you want to talk rural health, well, that's how I grew up. My family doctor was the one doctor for all of those islands. And he was a pediatrician, and he was a gerontologist, and he was who we called when our cat got run over. He was my friend's dad. He was my ski coach. And he actually tried to talk me into going into medicine because it's hard to get doctors to go out to remote regions like that. I took the engineering route and ended up here instead. But the bottom line is I really understand what it means to not have access to medicine, and especially all these new categories of advanced biological medicines that are now, proving out life-saving for many types of diseases. And this is really why we're here today. It's all about improving access to those advanced medicines. So we're here today to talk about what it's going to take to build a system that will enable us to thermally stabilize biologics so that we can tear down the barriers that prevent access. Right now, as Alicia mentioned earlier, things are very expensive, CAR Ts are very hard to get, and we want to change that world. So let's talk about biological medicines in a little bit more detail. What you can see is depending on the complexity of the biologic, we have different levels of refrigeration that are needed. But even for the simplest biologics, refrigeration is still an issue. So you may think, well, you can store, insulin, hormone, cytokine therapies in the fridge. Well, they're really meant to be stored 4 to 8 degrees Celsius. And I don't know about you, but my fridge does not keep a temperature that well. And we just had, we had a big hurricane go through North Carolina recently. And that one of the first messages of distress that I started to hear was, gosh, we've lost power. It's been hours, it's probably going to be days. What's going to happen to my medicine? I've got a 90-day supply of insulin, or I have a 90-day supply of immunotherapy, which is very expensive. And what am I going to do with my medicine? So it's a problem for small molecules. Cell and gene therapies, cryo is the only option. So liquid nitrogen storage. And if you're going to participate as a hospital in delivering CAR T therapies, you need to have that kind of qualified infrastructure at your facility. And of course, tissues and organs, I know there's some folks involved in that space in the room. No shelf life at all, hours to days. So across all of these categories, there is a thermal instability problem that we want to tackle. This program, BoSS, we've decided to focus specifically on cell and gene therapies, in part because it's a rapidly growing field right now. But if we can solve the cell problem, cells are used to make lower complexity biologics, and they're the building blocks for higher complexity biologics. So we really felt like that was the sweet spot to work on. And of course, if we can solve this problem, we can hopefully move from the situation currently, which is one of scarcity, to one of abundance, and have a healthier, more secure future for all Americans. So let's get into the cell details a little bit more. Let's use CAR T therapies as an example. So right now, as I mentioned, if you want to be a hospital that delivers CAR T therapies, you have to have all of that infrastructure for both taking the blood product from the patient and preparing it, cryopreserving it, to send it to the manufacturer. And if the manufacturer isn't ready, and there aren't a lot of slots for CAR T manufacturing, maybe you have to hold it on site for some period of time in cryo storage. And then there's the same problem on the other end. When the product comes back and you receive it, you have to have those facilities. So that's already just a barrier to entry for some hospitals. And then if we take a look at just on a patient-specific basis as to what kind of costs we're accruing because of this need to cryopreserve and to get things to the manufacturer and back, there are actually CPT codes. These are codes we use for reimbursement that are tied to thawing and handling cryopreserved products. So if you start walking around that circle, the journey of the cells as they go through this manufacturing process, you can see there's thousands and thousands of dollars every time there's a touch and a need for a technical specialist to handle the cryopreserved product and on all of this associated storage costs. So that adds anywhere from $20,000 to $50,000 to the cost of one single therapy. And that is still not even the biggest issue. The biggest issue is we have a really expensive product that's thermally sensitive, that we have a snowstorm like this, you get stuck the product gets stuck on a plane somewhere for a day or two, that's a possible loss of the entire product. That is more significant because typically the people getting that therapy, this is their last hope. So lose the product, probably going to lose the patient. So that's the patient view. If we then zoom out and sort of take an umbrella look over everything, over 150 million Americans, over half of America is taking a thermally sensitive medicine. So whether you're talking about a vaccine, a cell therapy, an immunotherapy, a blood product, this touches almost everyone. 45% of the top-selling biopharma products right now require cold chain, and those sales, cold chain medicine sales, are growing 7 times the pace of non-refrigerated sales. So this is really exploding. And look at where CAR-Ts are and how many things we have in the pipeline and where we expect the future of CAR-Ts to go. So this is an accelerating refrigeration crisis, I would call it. And then there's the costs associated with it. So $21 billion we spent last year on cold chain logistics. And again, with all of these accelerating categories, we expect this to be $51 billion by 2035. The losses, products are getting individually more expensive. So this $35 billion in product losses, that's actually a pretty old number. We're looking at probably well over $100 billion by 2035. And possibly even more than that because of this accelerating cost of our therapeutics. So the financial implications are also enormous. But again, what is the main story here? If we get back to thinking about the patients, look at how many people can potentially benefit from a CAR-T therapy. Right now, we're just treating a small speckling of blood cancers. But the promise is there for all cancers. The promise is there for autoimmune diseases and diseases of aging itself. But we're only delivering treatments in the thousands or tens of thousands. The need is in the millions to 100 millions. We're treating in the thousands to tens of thousands. So an incredible unmet need. So if there's anything you remember from this presentation today, it's this one. Patients are waiting. This is why we're here. This is why we do what we do at ARPA-H. This is a challenging program. It's going to get really tough at times. And this is the slide I'm going to point you to when you're saying, Gloria, it's impossible. You're asking for the impossible. We can't do it. We need more time. We need more money. I'm going to say, these guys are waiting. We've got to get to work. Okay, so here's the program vision. We want to break out of that cold chain, skip everything in between, and get to ambient storage. So out of cryo up to ambient, 200 plus Celsius degree leap in temperature. We want to build the system that can enable that. So we have easy storage and distribution, we expand access, and we accelerate health outcomes for everyone. So let's zero in on what the ask is. So we're looking for a platform biostabilization technology, and here's our short list. Generalizable approach. So we want something that works for all cells, scalable, right? We can handle small a la carte samples like we're doing CAR-Ts right now, but also it should be a system that's scalable to large scale production, which is where we want to be in the future. Should be GMP compliant, so closed system, aseptic handling. It should align with FDA. So we're expecting novel equipment, novel processes here, so we need to make sure that we can get these technologies approved. And it should be commercially viable. Seamless integration into pipelines. We want this pre-sold before the end of the program. And I have to say, I think we may already have done that because the cell therapy developers are in the room and they're on the call. So they're on board to do this. They don't want to be left behind, still doing cryo when the world starts to move on to the BoSS solution. So, short list, big ask. So how are we going to do it? So these are the technical areas that we identified. This came out of a lot of conversations and a lot of twisting the program different ways, but I wanted it to be very simple, and I think it is simple. We've got 2 ways we have to come at this. So we need to look at the cells and think about what do we need to do to the cells to make them amenable to going into this suspended animation state or this quiescent state or whatever state we want to put the cells in so we can store them at ambient conditions for a long time. We can't just zap them. We can't just throw them in a lyophilizer, or we've tried it many times, without the right amount of protection. And so it comes down to what is the right amount of protection? What are the right protections? How do we prepare? So that's what TA1 is all about. It's all about the biology and the materials chemistry we need to prepare cells for what's coming. And then TA2 is about the bioprocessing. How do we do it at scale? What kind of instrumentation do we need to build to deliver the suspended animation state? So, there's a lot of folks in the room that do drying, and we're all familiar, I think, with lyophilization. But there are lots of other strategies that we could consider here. So what this instrument looks like really depends on what you're trying to do. If you're polymerizing, it may be a light machine that polymerizes your cells as they pass by. It may be some kind of a spray drying apparatus. Really, this is up to you. Bring your best solutions here. We're not stuck on any one type of approach to do this. And quite frankly, I'd like to see something really new come out of this program. So at this point, I think it would be fair if you're still thinking, she's crazy, we can't do this, the timeline's nuts, the program's insane. I wouldn't judge you for that, but hear me out. It's not impossible, right? Nature can, so why can't we? So we've learned a lot. We've been studying extremophiles like the anhydrobiotes, the tardigrades, the brine shrimp, the resurrection plants. We've been studying them for a while and trying to learn their secrets. We've learned a lot about glass-forming solutes like Trehalose, protective proteins like the IDPs, the intrinsically disordered proteins. We've learned about dehydrins. We've learned recently about structural strategies that extremophiles use. This complete rearrangement of the cell, depolymerization of F-actin, these membraneless organelle formations, reorganized cytoplasm, protected membranes, DNA binding proteins. So there's a lot that goes on in extremophiles to ready the cell for what's coming. On the engineering side of things, we've been studying different process concepts, slow versus rapid drying, and looking at how nature does it. We don't have to always do it exactly the way nature does, but it's good to know. Like, is there a trick? Should we go fast? Should we go slow? Preconditioning with stress cues. There's things we can do with polymers and matrices that can mimic what the cell does, so biomimicry methods. Reanimation methods. So sometimes that's an afterthought. Just like in cryo, thawing the cells is just sort of an afterthought. No one puts a lot of work into thinking about that. I think the same is true of drying approaches and what we reanimate with and strategies we can use to do that better and more gently and maybe rejuvenate the cell. And tons of enabling technologies have emerged in recent years, because with eukaryotic cells, they don't make Trehalose. A lot of these things we're studying, they're not native to the cells that we want to preserve. So we have to figure out how to put those things into cells. And so that has spurred a lot of technology investment on ways to porate cells without actually damaging the cells. So super busy slide, but intentional. These are just a handful of buckets that we have for strategies that we can pull upon to maybe converge on a solution. So whether I just talked briefly about intracellular reorganization, Trailose, IDPs, the intracellular packing and protection, membrane poration, all the different ways we can load things, extracellular protection, like encapsulation approaches. There have been studies on osmoprotection, ways to coat cells so you can slow down dehydration. And reanimation solutions. We've seen some things in the cryopreservation space that can improve the thawing of cells. And I don't think we've done a lot there in the drying world, but I think there's a lot of opportunity there. What I want to call your attention to, and this is the part where you start thinking maybe she's not so crazy. These are from the last 2 years. So I just grabbed papers from technology development just from the last 2 years in all of these categories that I think are ripe for the picking for a convergent effort to really have a run at this ambient preservation solution. So that's the hypothesis. If we can tap into all of these new innovations that are very fresh, maybe we can do this. So that's TA1. Those are a bunch of TA1 solutions. Similar things have been happening in TA2 space, so on the processing side. So we've been lyophilizing chemical molecules, small proteins, some bigger proteins. We're starting to do liposomes and encapsulated RNA, things like that, nanoparticles. So we're getting better at drying and polymerizing and processing increasingly complex systems. We just haven't really done the cell well yet. But there's hints that we're getting close. So there's a lot of ways we could come at this. I think there are a lot of what we would call early MRL approaches. So MRL is like a TRL, a manufacturing readiness level. We've, again, a spattering of papers from 2024 and 2025, all new tech that's worthy of exploration. Some of these need some work, I think, to become GMP compliant. Open systems, open air systems are not great, but we have to find ways, I think, to remove moisture, but do it in a contained system. So a little bit challenging, but I believe you can find the solution. So that's one approach. Or we can leap over to the processing approaches that are already mature. So we use spray drying, for example, a lot in the food processing industry. And if you haven't been watching that space, wow, it's becoming super high tech. They're doing amazing things with intelligent coatings that are responsive to environmental cues to keep our food fresh for longer and processing things so the flavor is better, the texture is better. So I think there's a lot we can learn from that field that we can then maybe adapt. Food we eat is dead. We need to keep things alive. So there's probably some adaptations that are going to be needed, but the bulk of the systems have been designed. So again, these are non-exhaustive examples, but they're the things that make me believe that this isn't a crazy idea. Okay, so I wanted to jump into this focus, the cellular focus for the program. We did publish a modification, I think it came out on Monday, and we specifically wanted to drill down on this in a little bit more detail. So if you haven't downloaded the recent ISO and you had questions about cells, it would be a good idea to go back and download that new version. So some of you may not be familiar with IVNV. What this is independent verification and validation. And why we do it is we want to make sure that what's happening in your lab can be done in your lab, and your lab, and your lab, and your lab. And we all know, if we've been in R&D space long enough, that we develop these wonderful solutions, and then we send them to another lab, and they're like, it isn't working. You didn't give us the right directions. We did. We gave you the right directions. It isn't working for us. And this has happened over and over because there's something in the art of what you're doing that you didn't capture in the SOP, and you don't know what it is. And so this is one of the purposes of IVNV is to start wringing out some of those problems early on so you don't make a major investment in something that could only happen in one lab. The magic is there and nobody knows why it works there and it doesn't work anywhere else. We're also interested in the generalizability of your approach. Will it work for other cell types? And we want to do that testing on cells that are very stringently validated already. So that's the purpose of these government cell lines that we're going to provide to you for testing. It is not the bulk of your program. It's just a stress test of your system, of your methods, of your SOPs at key junctures in the program. So we have time to fix problems. We have time to adapt. We can feed back to you. Nobody can follow your SOP. Like, you need to do another iteration on it. Or, wow, your method was great. It not only worked for the cells you're working on in your lab, but it worked on the 2 other cell lines as well. So this is good information for us to help us make decisions about what we should do going to subsequent phases. So minimally, you will get 2 cell lines from us that we pay for, we provide to you, you process them, you send them to our IV&V partner. IV&V partner is going to do the full assessment on them, and then we'll report out on how well your method did. And this is just a piece of data that we will use. You should also be carrying minimally 1 commercially relevant cell line through the program. That is the absolute minimum that you can get away with. You really should be evaluating more cell lines than that. I would say putting all your eggs in 1 cell line and hoping for the best and then hoping you have a generalizable approach is probably a pretty risky way to go about it. So I encourage you to flesh out your programs with multiple cell types of interest. So you hedge your bets. And it may be that we end up with a system, it's not what we're looking for. We're not looking for a cell line specific system. But if you end up with a system that only works for CAR-Ts and it's beautiful, well, the investor community is probably going to pick up. If you graduate early from our program, there's still a place for you in the world. And I think at that point, you'll have a lot of people interested in talking to you. So that's IV&V. That's really it's just more knowledge for us. What else did I want to say about this? Oh, the cell types. We really want to focus on cells of therapeutic interest. This is not an exhaustive list, but it is in a list of examples that we want you to think about. So we're very interested in cells as therapies, but to a lesser extent, cells as producers of therapies. So your CHO lines, your HEC lines, those are probably good cell lines to start your early development on. They're probably going to be a little bit hardier. So I think having them as one of the cell lines of interest is probably a good idea, but really what we're trying to drive at is impacting patients. So keep that in mind as you select your cell lines. Okay, overview of the program. I'm not going to go through all this in detail. This is in the ISO. I just wanted to point out a few things. There are down selects in the program. We are going to field more teams at the beginning than we're going to take all the way through. So we see this first 12 to 15 months is really a hard run at the tech, right? Converge all of these possibilities, see what sticks, see what works. Expect it to be totally messy and lots of failures and lots of, gosh, we got to go to plan B, plan C, plan D. So it's important that you have risk mitigation built into your program here. We expect this to be a tough, hard grind for the first 12 months. And then we'll see where we are. We take a good look at where we are, how generalizable it is, how well you're doing on the parameters. We don't have very high expectations for performance at this stage, but we do want, and I'll get to the metrics here real soon, we do want to see more than 0. So if you have 0, 0, 0, like nothing is living, you don't have a dial to turn. But if you get 20, 30%, now you can say, okay, well, what if we use, dried faster? What if we put in more protectants? You have somewhere to go. So that's really what this first phase is about. Fail fast. Let's get rid of all the things that aren't going to work and pull those Band-Aids off and pick the things that are going to work. So there is going to be a down select. Not everybody's going to go through. We may need to rebuild some teams, and that's what that first phase 1 is going to be about. I think in the interest of time, all of this is really online. So I'm just going to comment a little bit on the second down select. So after the first down select, it's really about the enabling technologies and making sure we have some dials we can turn. The next phase would be about tweaking those dials. Like, let's optimize this and make sure we can get to better cell viability, less apoptosis, more function. And then phase 2B, once we get there and we're confident, we're getting to the percentages we need to get to, and that we can improve the processing outcomes, the next phase in is there'll be another down select, because then we're going to larger scale. And so it's a big investment to invest in bigger infrastructure. We can't do it for 6 or 8 systems, so we're really going to pick what we think is going to scale best and give us what we're looking for at the end of the program. Phase 3 is light, all right? Phase 3 is just going to be about making sure the T's are crossed, the I's are dotted to get the program transitioned. So I have a few more slides on that. I think I'm going to skip this one right now in the interest of time. All of that is online. I mentioned the metrics, so just pointing out phase 1, these are very low bars, as they should be, because we are cobbling together a lot of tech. The bioprocess metrics, basically how fast you're doing what you're doing, also pretty generous, right? But in the end, we want fast, speedy processes, but you don't have to have all of that up front. And the production scale is small, 1 to 10 mils. We're just really still at the concept stage here. As we go through 2A, now we're dialing it up, right? We want to see higher viabilities, good metabolic activity, no change in the cell identity. Now we start pushing the shelf life as well. We want to make sure that your preserved product is demonstrating stability over a month. Reanimation time, again, we're trying to push that time down. It's okay if it's a little fussy at this stage, but we're driving everything towards the commercial system that we desire. Still working small at this stage, but pushing all the other metrics. 2B is when we start moving to large-scale demonstrations. So that's a summary of everything. So it's just the same information. We just put it in the table so you can see how everything scales as we go forward. Phase 3 is really about adoption. Okay, so those metrics are your metrics. We haven't prescribed metrics for phase 3, and it's really going to look different depending on how your team is made up. So I got some questions about what's the ideal team look like? Well, there isn't one. There isn't one particular makeup. What we really want to see is that you're covering all of the needs. So depending if you're an academic-led group, for example, you probably have subject matter experts in spades, right? You can reach out, you can find a biologist, a physicist, an engineer, that's easy. You may need to bring in help, some regulatory help, regulatory guidance. You may want to partner with a cell therapy manufacturer. You certainly want to start talking with some manufacturing experts. So those are the people that you're going to need to go out and find to complement your team so you have a total solution. If you're biomanufacturer-led, you have almost all of that in-house. But you may need a little bit of regulatory guidance and probably some folks from the extremophile world, some subject matter experts that you want to pull in. So your team might look a little leaner because you've got a lot of your labor in-house already. If you're a device developer, if you're a TA2 is your expertise, you know how to build systems, you know about regulatory, you've been there, you've done that. You may need to work more with your customers, the people who have cells that you want to preserve and understand what their workflow looks like and what their specific needs are and what it means to keep a cell alive. It isn't just a live dead stain, and understanding all the requirements of a product that's actually going to be injected in the body. And then what are we looking for in an IV&V partner? Well, they need to be independent from all of the technical teams. And that's why things are staged the way they are. We need to do our technical performer team sourcing first, And then we're going to evaluate our IV and V partners. And that's why we can't say, here are the cell types that we're going to give you, because we're going to be sourcing that after we source the technical teams. But we will make that information available, the lines that will be available to you, and who the IV&V partner will be as soon as we get them under contract. So you will know before you start your program what those cells will be, how many vials you're allowed to have for free from us, and how that interaction is going to be. And they'll be there, part of Proposers Day as well. So actually, I wanted to say one more thing about this. So these slides kind of go together. What phase 3 is going to look like very much depends on what your team looks like. If you have a cell manufacturer on board from the beginning, wanting in, you have pre-sold your solution. So if you're successful, you have a cell developer that's going to use that solution. So that's a wonderful situation. But you may not be in that position, and that's okay. If you want to bring on your phase 3 partner a little later in the program, if you want to see if you get into phase 2 before you put that effort in, that's okay. But what those metrics are going to look like in phase 3 will depend on if you've already got a cell manufacturer on board there, you already have your partner. So your phase 3 might look like FDA regulatory experiments that you need to do. If you haven't pre-sold your a partner and you're looking for a partner, it may be the experiments that your transition partner want to see. They may want you to demo exactly on their cell type, and they may have very specific conditions that they want you to evaluate. And so that we'll be supporting you through that process, and what that will look like. It'll be what it needs to be. But we expect it to be pretty light phase. So when you're putting your budgets together, we're not asking for cost share in phase 3, but we definitely want to see some skin in the game. So really, those budgets shouldn't be extensive in phase 3. It should be just, some of your staffing to do those types of demonstration experiments. Your system should be built out by that point in time. There shouldn't be too much new happening at that point in time. In scope, out of scope. So as I mentioned, again, these are all in the ISO, so I'm not going to read every bullet point here. Just at a high level, we're not looking for incremental science. We're not looking for systems that we've already been playing with for a long time. Don't bring me your grandmother's lyophilizer. We've used it. We have 100 plus years of trying to lyophilize cells with existing equipment. It isn't cutting it. But if you've got a next-gen lyophilization solution, I want to hear about it. In terms of demonstration systems, as I said, really want to focus on cells of therapeutic interest, to a lesser extent, cells that are producers of other therapies. Don't want to see mouse fibroblasts predominating your program proposals. Other people will fund that, but we're going for the goal. There are lower hanging fruit, absolutely. We are not picking it. We are going to the top of the tree and picking the hardest cells because the patients are waiting, all right? We want to get to therapies as fast as we can, so we're going to start with therapies. Same thing on the bioprep. Like there's a lot, use your imagination, use AI, high throughput screening, whatever, DOE, any enabling tools that empower you to go faster and get to a solution faster, we're down for it. Not in scope, already mentioned some of these. I wanted to point out why we're not doing some of the systems. We've ruled out a number of systems. We work very closely with our other government counterparts, especially DARPA. They have a lot of programs. They have active programs right now on red blood cells. They have active programs on microbial cells. We stay in our lane, they stay in theirs. So they do a lot to serve the service member. So they're doing a lot with wounded warriors, hence blood products, trauma products, et cetera. We're staying on the other side of the lane and picking up where their programs leave off. There's a lot of enabling technology that suit across the agency, and we are in close concert on all of that. Okay, I think I've mentioned everything else on here. Timeline and details. I've been asked, like, how long is it going to take us to go through this? What's this going to look like? We are aiming, especially with Elisa Jackson on board, we are aiming to go very fast. So we are going to be turning around your solution summaries as quickly as we can and getting you feedback. Those will be encourage, discourage. We've done some creative things with this program launch. We're reducing the burden of writing on your part to the critical stages. So solution summary is a short write-up. What we're really looking for is, do you have the team? Do you have the knowledge? Do you have the wherewithal? Do we think you're complete or close to complete? So if you come in with a solution summary that says, well, you know, I have a piece of the TA1 solution and I'll figure the rest out, probably not going to get encouraged, because you know, we want to see more robust proposals at this stage, more robust teams. We'll turn that around quickly. Then we're having the solution pitch. We're not asking for a full written proposal. We are expecting that level of knowledge about what you intend to do. So you should have a program plan that's, excuse me, detailed, but it can be your rough notes and your sketches and your binders and PowerPoints, et cetera, that you don't have to show me, but you need to show up to that solution pitch and be able to answer detailed questions on your approach and strategy. Then if you get selected, then the writing comes. Then we have to get ready to go into contracting. And if you've been on a DARPA contract or an ARPA contract, you're probably familiar with the TDD, the task description document that goes on forever and has great detail, and milestone documents, milestone payments, so what we're going to pay you for and what we're expecting every single month. Like we're going to lay this out month by month. So, but you're already selected at that point. So it's a heavy lift when we get into contracting. And if you want to get awarded quickly, we're going to have to iterate on those contracts pretty quickly. So you can expect to roll up your sleeves and put some sweat equity into building out those TDDs pretty quickly at that point. But you're already selected, so you should be motivated to do that. So we're hoping to get through contracting lickety-split time, fast time schedule, tentatively getting 2 awards by the end of June. And we have fire-breathing dragons behind us telling us we should do this. So we are very motivated to get that done. And if we are successful, then we could be looking at a kickoff as early as maybe September 2026. So that's still this year. That's good for the government. Key dates. You saw the QR code. We're at the end of my overview of the program. I'm excited you're still here. I think we can do this. Hopefully you think we can do this right now. But just imagine if we can. Just put yourself in the mindset of 4 or 5 years from now, we're at the end of the program, and imagine if we've done it, right? Just think of how we move cells around the world after that. Instead of installing cryogenic refrigerators all over America, soaking up all of our energy and competing with our data centers for electricity, we can get back to planting trees, right? We won't need these big cryo refrigeration warehouses all over the place. We'll be able to ship cells to patients wherever they are, whether they're rural, whether they're working on our space station. We'll have lightweighted products we can take out to remote environments. We can equip our soldiers that go overseas. We can lift up the entire ecosystem. So all of the cell types we use in R&D, moving those around more easily will just allow us to scale immensely across so many categories. I think we can spare a 15-minute break. Thank you, everyone.
I hope everyone enjoyed their coffee break. But once everyone's back in, we'll have Annie come up and she's going to answer a couple of questions that people have been submitting online and you all through the QR code. If this feels like a great forum for you and you feel like you're learning a lot through the QR code, we are going to do this one more time later in the day. So Please keep the questions flowing, and I do believe if they're not answered live today, they will be answered at the FAQ site on the BoSS website later. So I think we've reached quasi-quorum, so I'm going to just hand it over to Annie to answer some of your Q&A.
Thank you, Isabella. It's great to see everyone here. It's a very exciting day for all of us, including myself. We're getting a lot of questions, so we're prioritizing the ones that are most applicable to everyone. But please continue to submit your questions. We will get to them as soon as possible. One of the questions also that we're getting, this isn't something that we're going to post up on an FAQ, but a lot of people are asking whether or not they can submit materials ahead of sidebars or, ahead of submitting their proposals. Unfortunately, this would provide some types of bias, and we don't like that, especially in the government. So please, the sidebars and the things that are discussed with the program manager, Gloria Elliott, are going to be more clarifying. So, there's no reason to skew or have any bias in the system. So please keep your materials and your proposals at a minimum when discussing in sidebars. Again, it's more for clarifying questions. But now to some of the submitted questions. Thank you, first and foremost, for all of you that submitted your questions. Let's see, let's get to it here. So one of the earlier questions that we got was, can multiple approaches be proposed by a single performer team? So yes, multiple approaches may be proposed by a single performer team to demonstrate feasibility in phase one. However, performers are strongly encouraged to consider structuring their efforts around a single well-justified primary approach, with additional approaches included as part of a clearly articulated risk mitigation strategy, for instance, as fallbacks rather than fully parallel, equally resourced tracks. Performers should also account for the fact that a sufficient but finite number of cells will be provided to performers, and they should plan their experimental design and allocation of materials accordingly. If you do have any follow-up questions to the responses that you are hearing today, again, please submit them through the portal. We get a lot of questions about how much are the awards to each performer team? I mean, understandably, or in other words, people ask, how much should the proposed budget be? Of course, we'd love to give out those numbers, and I'm sure you'd love to hear the responses for that, but I have to refer you back to the BoSS ISO, section 6.4. The last criteria is criteria 4, entitled Assessments of Proposed Cost or Price. And this describes how cost proposals will be reviewed. In summary, cost proposals will be evaluated for cost realism, and this is to ensure that they are consistent with the proposed technical approach, team capabilities, and related experience, as well as ensure the accuracy, that it accurately reflects the program technical goals and objectives, and that the cost proposal demonstrates a sufficient understanding of the resources and effort required to successfully execute the proposed work. All right, and then are the BoSS performance metrics intended to be interpreted as strict pass-fail criteria, or can performers justify alternate surrogate metrics that better reflect biological function or clinical relevance for a given cell type? So the BoSS, the ISO, provides metrics that are a minimum requirement to assess the measurable performance of bioprocessing system and the biostabilization technologies. Proposers are strongly encouraged to include additional well-justified metrics to generate sufficient data during the program that can support the ultimate translation of stabilized therapeutic products, including for use in regulatory submission reviews after program completion. All right, and then let's see. As this is going to be, yes, as the lead agent of a performer team, what specific reporting requirements are expected, particularly regarding progress against feasibility metrics, IV&V coordination, and team deliverables? So within the first 90 days after program kickoff, all performer teams and the IV&V partner must establish and execute a material transfer agreement to govern the transfer, use, and management of biological materials and related data Each month after program kickoff, performers are expected to submit a monthly status report and virtually attend monthly meetings with the program management team to review progress made towards the metrics and milestones of the associated phase in order to release payments tied to each milestone. At the end of each phase, the lead from each performer team is expected to meet with the program management team in person. So again, going back to the cost proposal, please be sure to budget that in. This information is described in section 3.4 of programmatic deliverables in the BoSS ISO. All right, I think in efforts to make up some time, I'm gonna hand it over to Andrew because he has probably a lot more of the answers that you guys have questions for. So this is Andrew, our agreements officer. Thank you.
All right, good morning, y'all. I'm like a lot of y'all, had to travel, and I'm not used to all this weather. I came from Alabama, but I just wanted to say that I'm not used to this. So I'm gonna pick this up, try and use my outside voice a little bit. Thank you. As was mentioned, my name is Andrew Stark. And I'm one of the agreement officers out of BID that supports SSO. I support Gloria, and I'll be supporting her on this program. I'm going to cover quite a few things today. Most of this stuff you'll find in the ISO, and so you'll hear me. You've already heard it multiple times already. Please read the ISO in entirety. If you have any questions, go look and see if the information you're looking for is in the ISO. But then if you're not able to find it, please use the QR code. We'll work on getting a response for you for any questions you have. Some of the things we're going to cover today is, the contracting structure that we're going to use, the submissions, the selections, what we're looking at, the evaluation. And so what we plan on using for the BoSS awards is other transactions, also known as OTs. They're not your standard FAR contracts, not grants, not cooperative agreements. The great thing about them is they're still legally binding, and they're not subject to a lot of the traditional FAR requirements or statutes that you might see. So this allows us to be a lot more flexible. They're similar to commercial contracts, much more flexible, much more collaborative. Allows us to have freer negotiations, more tailored terms, but still be accountable. You will, if you go look on our ARPA-H site, you will see a other transaction community. It's a great resource if you haven't been out there already. And you'll be able to see all kinds of information about doing business with ARPA-H. You'll see out there a other transaction model that we use, agreement model, that you can get familiar with what a lot of our common articles, language that we have in our agreements. So I recommend, if you haven't done so already, go check that out. And it'll kind of give you an idea of what that would look like if you end up having an agreement with us. Next slide. Here you have the selection process for the technical portion. As Gloria mentioned, we'll have a technical performers, but there'll also be IVMV. And so first I'll go through the technical side. It's going to be very similar, parallel track, but slightly different as well. First stage, and I'm not going to go through all this, try to make up a little bit of time, but the first stage is the solution summary stage. That you've got the submission deadline there, February 19th, the format of what that needs to look like. And the stage is for us to provide feedback to y'all when you submit. And then, like Gloria mentioned, you'll be told to, or be given a encourage or discourage on the next step. Like I mentioned several times, and others have, please make sure you're reading the ISO. For the next stage, the solution pitch stage, there are attachments there. You've got your Appendix C, attachments 1, 3, and 4, that provide you with information on what it should look like. You'll also have the evaluation criteria. We'll get onto that later on. I have that on a separate slide. We, as Gloria mentioned, we are going to be moving quickly on this. We have the support that we need to make that happen. So we are absolutely going to be reviewing these as quickly as possible and getting responses to you in a timely fashion. Next, we have how the review process. This is a very high-level overview of the stages for the technical performers. So I already covered some of this. You already saw some of this on the previous slide. One thing I do want to mention is that the pitches, the supporting documents stand on their own from the solution summary. So we ask that any information that you have in your solution summary, if you are encouraged to submit a pitch, please make sure that any information that's in your solution summary, you have that in your pitch as well or in the supporting documentation, because those are evaluated separately. Everything will be submitted through the ARPA-H Solution Submissions portal. You've got that link there, but you'll also find that in the ISO as well. The IV&V track is very similar. I'm not going to go through and read all of this. Y'all can look at that in the ISO, but all of that is in there as well. Again, the evaluations are independent. They're not comparative, so we're not comparing all of y'all's solution summaries. We're not comparing your oral pitches or anything like that. Everything is very independent. The review process for the IV&V is very similar as well. The timeline is just the part that is a little bit different, but otherwise very similar process. So depending on if you're looking at proposing to technical or if you're looking at proposing to the IV&V or both, they're very similar process. Here are some of the highlights of the evaluation criteria for the proposals. They are listed in descending order of importance. Not going to go through and read all of these. They're all there. They're on the ISO. I think they are on our ARPA-H site as well, or at least broad ones. Thing I will say, once again, read through this one because even though they're similar to maybe some of the other criteria that you see in some of the other ARPA-H programs, there might be slightly different. Gloria took her time. She spent a lot of time with the team, went through and looked at these. So while they may be very similar, case in point, overall scientific and technical merit, that part might look the same. If you start to look at the bullets, they might be slightly different from some of the other program criteria that you'll see out there. So please make sure as you're writing your solution summary, as you're working on your solution pitch, that you're looking at these specifically in the BoSS ISO. A few more reminders. Once again, read the ISO. Please register. I think most of y'all probably are already registered. Register in sam.gov. Some of your organizations may already be registered there. If you are not, I recommend that you go ahead and start looking at that. That system is not controlled by ARPA-H, and so we are not able to help you with that. And we want to make sure that everything done is done in a timely fashion. So I recommend that you start working on that sooner rather than later, so you don't have any potential delays due to getting your proposals your pitch solution in. That is something that we will expect you to have in place by the time your solution pitch comes around if you end up submitting one. Next is the teaming. There's a few slides here that I've got. Teaming happens a lot in the government, but also in the commercial world. And there are a couple different ways we can do this. You probably are familiar, quite a few of you are familiar more with the prime sub type scenario. That's not what we're looking to do here in the BoSS program. We're hoping to do multi-party teaming. And Gloria already mentioned and spoke about that some. She had a great slide there, but I'll go into a little bit more about it. At a high level, teaming is just about assembling the right mix of capabilities and not doing everything, with one particular organization. Think about as you're putting your team together, who should lead on the core technical work, who brings, the user clinical operational insight, who can help with data deployment and commercialization later on. These are all things that you need to think about, and Gloria brought all that up. The great thing is BoSS gives flexibility in the team design. We are able to switch out the team lead. And I say lead, I don't mean that as an individual. That could be an organization, it could be a university, it could be a company. So that person can always be switched out. So think about, as you're putting your team together and as you're thinking about the phases, maybe one particular organization on your team might be in a better place to lead at the beginning, and as things progress, you might want to swap out and have someone else lead later on. I already kind of went into some of this a little bit. There's a few different disadvantages and advantages to each one. I'm not going to go into the prime sub. I'm not going to spend time on that just because that's not what we're looking at doing here. Privity of contract is one of the things that is important to discuss, though, when we talk about teamings and types of teams. When we talk about privity of contract, we're basically talking about the legal relationship that the government will have with the performer team and the actual party or signatory on the agreement that's bound to those agreement terms. A little more on that in this next slide. Talked about this some, but multi-party team is where you typically have multiple team members that come together to form a single team. These team members could be universities, companies, biomanufacturers, other organizations. And like I said, Gloria went into this some. This team would have a teaming agreement between them. And sometimes that could be called articles of collaboration, but it establishes the teams, the roles, the responsibilities that brings this team together. While the government will sign the agreement with the team as a whole, usually only one team member, the lead member, would sign on behalf of your team. Privity of contract in this type of agreement, team agreement, is between the government and the entire team and each and every one of the teams. Some of the disadvantages: if you have a large team, this arrangement can be a little burdensome in some cases, just because there are a lot more people involved since you have multiple organizations. And if there's not a strong leader on your team to make sure everyone's going in the right direction, you lose loss of focus and lack of progress due to a lack of cohesiveness and teamwork, and it can be a little slow. So that's one of the disadvantages. Some of the advantages, though, is that the government can have insight and visibility into all the aspects and levels of the technical management actions. I know Gloria especially is excited about that. So it tends to be a little more collaborative. It can be advantageous to all the members in terms of benefit and progress. Some of these multi-party teams end up working so well, the alliances are built. Teams live beyond in this case, it could live beyond the BoSS agreement. And much like partnerships, one of the greatest advantages of multi-party teams is that leadership and membership can change dynamically as the program evolves and change. And so I think it was Blake that mentioned, everyone that is here in the room, please network, please talk to each other, and get to know each other. You just never know who in the room across from you or sitting next to you might be able to help you out on this program or maybe even on something in the future. Under section 3.3, offers are expected to enter into a multi-party teaming. Your submission must identify an agent, lead organization to handle the administrative part and act as the primary interface with ARPA-H. When we award under the agreement, we're awarding to the team overall, not just to an individual entity. So a teaming arrangement must be executed. We're not going to be asking we don't want to be involved in putting together your articles of collaboration, your agreement on your end, but that is something that we will look to see before we make any awards, is that you have a agreement of some sort in place with your entire team. It should describe the team structure, it'll bind members to the team to the agreement, it'll give roles and responsibilities, and cover the scope of the BoSS program, as well as allow lead organization change during the performance. Other than that, we don't need to be involved in that as the government. That's between y'all, but we will expect to see something in place signed by the entire team, all the members involved. So Amy Lynn is next. Like everyone has said, if you have any questions, please look through the ISO. I'm going to say it again. Please use the QR code. Annie Welch has been great about getting those questions if it's anything I need to help answer, or if it's anything Gloria or anybody else needs to help answer. Annie has been great about putting those questions together and getting those answers out promptly. So yes, please, if you have any questions at all, use that QR code. We will get you answers to anything that you might have. And appreciate your time.
Thank you, Andrew. Appreciate that. I hope that was illuminating for everyone. I know it was for me. You know what they say about government contracting? It is the spice of life. So, thank you. And up next, we have someone who is absolutely sick of seeing my face, but is very good at hiding it. It is our incredible acting director of international affairs, who I share a team with, Amy Lynn. So, Amy has a background building global partnerships across public and private sectors to advance and deploy health innovations, and she's going to tell you a little bit about how you can interact with potential international performers, or international performers can interact with BoSS. Amy?
Thanks so much, Isabella. I can't wait to find out what they say about the spice of life for international engagement. So thank you, everybody, for joining us today, and we're so thrilled to have you online and in the room and participating in this conversation. As Director Jackson started the day, we are tackling really big problems here at ARPA-H, and as Gloria followed up, it's a very big problem that the BoSS program is tackling indeed. And to tackle those types of problems, we need to draw on, as Director Jackson said, the best people in the world to work with. And that includes you in the room, that includes you online, and that may include those who are not yet in the room or online. And that's part of your mission, is to find the best ideas, the most cutting-edge science, and the best expertise wherever it is, so that you can bring those ideas to us to respond to the very high challenge that the BoSS program has set for you. Gloria mentioned earlier that we are looking for a wide range of expertise and a way for them to come together in an integrated, powerful solution. We need to find experts in cell therapy, in subject matter experts in materials, in manufacturing and technology and device development, and they all need to be able to find ways to work together and seamlessly in exactly the teaming arrangements that Andrew was just describing. That's a tall order, but that fits with all of the other dimensions of ambition that we're looking for here at ARPA-H and specifically with BoSS. So we often get 3 questions around international engagement, and they're on the slide. One is, can ARPA-H fund R&D activities outside the US? Can we directly fund a foreign entity? And how are intellectual property rights determined? So let's take them one by one. Can we fund R&D activities outside of the US? We can. We do prioritize funding activities inside the US, and all of our activities, including for BoSS, are directed at problems faced by American communities. But we know that those problems are often shared outside of the US as well, and therefore the expertise and capabilities and other specializations may also exist outside the US. So the answer is a yes, but we did want to emphasize that the end goal is to meet the needs that we're seeing here in the US, and therefore the solutions should be designed for our settings and circumstances. Can we directly fund a foreign entity? Yes, we can, and we have. So we welcome submissions from different parties, and we're really looking for the best ideas and capabilities brought together. Anybody who's applying will need to register at sam.gov, just as Andrew mentioned earlier, but foreign entities are also eligible to obtain a unique entity identifier that is required for submission. There are limits on who we can fund, which countries, and so there are 4 countries of concern as detailed here in the citation, and so the entities based in those countries would not be eligible, but others would be. And then the last question we often hear on the international engagement side is, how are intellectual property rights determined? This is determined just as it is for any domestic entity on a case-by-case basis. So in that negotiation phase that Gloria mentioned, that will be intense, maybe a grind, but it will be worth it because you know you're already selected. That's where those discussions will take place and those terms will be sorted out. So this is regardless of where you're headquartered or where your organization is based. We take a very tailored approach to these situations because we know we're asking for unusual solutions, and they may come with unusual circumstances, and we want to meet those appropriately. Finally, there's been a lot of discussion about the QR code, appropriately so. If you have program-specific questions about BoSS, please continue to send them into that QR code to get them answered in as specific and prompt a way as possible. If you have questions specifically around international engagement, some of these dimensions around how to work with partners from different countries, then feel free to reach out to our international team here at international@arpa-h.gov. So with that, I'll wrap up my overview here. We're really thrilled to see how partnerships can be formed from anywhere, drawing on the best science and the best minds. And we leave that as part of your mission to find those ideas, find that science, and bring them to us by the appropriate deadline. Thank you.
Great. So we've gotten a lot of submitted questions and just talking with people and I know the contracting stuff is really difficult. And so we want to provide you with resources that you can look this up. So right here is a link if you want to just take a quick picture, but we will send this out next week along with a recording of today's webinar. So everyone has access to the resources that you need. If you access this link, it will give you the web page for other transactions agreements that we discussed earlier. But if you scroll down to the very bottom, you can actually see templates of what that looks like. Obviously, after going through the negotiations, the template, it's going to look a lot different, your agreement, than the template. But this is very base language that I think can be really helpful to a lot of you here that may have questions and just get some familiarity before that process starts. So hopefully that's really helpful. And right now I'm just going to go through some of the questions and see how much we can go through at this time. But again, we encourage you to submit any of your questions through the portal and up until a few days before the proposals can be submitted. We'll try to get them as soon as possible. We'll also post up on our FAQ page for a lot of the general questions that all of you may have. But starting with that, first question, is it acceptable that a commercial and or non-commercial software, including source code, software documentation, and or technical data developed by a performer team member during the program remain owned by that team, for instance, as a trade secret, as long as it would not interfere with the commercialization and adoption of integrated BoSS systems and associated products? So in that response, the government does not require ownership of all software, source codes, or technical data developed under the BoSS program. Performer team members may retain ownership, including as a trade secret or other proprietary IP, provided that the government receives licensing rights sufficient to use, operate, test, and evaluate the integrated BoSS system across relevant government users, maintain, modify, and upgrade the system directly or through support contractors, and support transition and potential follow-on activities consistent with the program's objectives. In most cases, the government anticipates obtaining at least government purpose rights in technical data and software developed under the program so that the government can use the results for government purposes, including potential follow-on competition and broader deployment without being unduly restricted by proprietary claims. Any proprietary or trade secret software and data must be appropriately marked and licensed on terms that do not impede deployment, sustainment, or further adoption of BoSS system and associated products. Specific rights and licenses will be established in the award document in accordance with applicable law and regulation. So this is a response that is currently accessible on our FAQ page. So if that was a lot to take in just now, you can definitely look back at that. This is the question that we commonly get. So just for clarification to the question, are performers limited to using the government selected cells? Performers are not limited to using government selected cells and are encouraged to demonstrate system generalizability by evaluating concepts on multiple cell types as early as in phase 1. A commercially relevant cell type specific for phase 3 industry transition may be used as a demonstration cell type throughout the entire program, as long as the minimum requirements for end of phase demonstrations are met. To allow IVNV, the independent verification and validation partner, to allow the methods and approaches to be assessed at the end of phase 1, phase 2A, and phase 2B. Performers are expected to demonstrate on 2 government selected cell types, but again, this is a minimum requirement, and other performer selected cells may be used to demonstrate bioprocessing system performance. At the end of phase 2B, in addition to the IV&V evaluation evaluation on 2 government selected cell types, demonstration of a 3rd performer selected cell type is expected. That same thread. Well, let's just continue on. So does ARPA-H expect that proposed multi-party technical performer teams to formally include partners with expertise in regulatory engagement, commercialization strategy, intellectual property management, and pricing market accessibility analyses? Or is it acceptable for these functions to be addressed through planned engagements or subcontracts? For instance, advisors, consultants, or future partners that are not formal members of the multi-party team at the solution summary or solution pitch stage. So it's strongly recommended that the multi-party team submit proposals as technical performers that incorporate all the expertise needed to achieve program milestones and goals, including but not limited to regulatory affairs, commercialization, IP management, and other relevant business analytics and strategy capabilities. Demonstrating that such expertise is represented within the team at the time of proposal will strengthen the overall quality and credibility of the proposal. These capabilities may also be added after program initiation, provided that appropriate roles and associated costs have been anticipated and budgeted in the original proposal. So can a proposer work on more than one team? And I think this was a great question because we saw a lot of exciting things here today earlier. Yes. However, yes, if you provide capabilities that multiple performer teams desire. However, you cannot be a lead on more than one team. The program does not restrict your participation in multiple teams. The caveats are based on the relationships between you and your other team members on different teams. For example, how pre-protected IP, intellectual property, and or newly developed proprietary information may be shared among teams. So that's something for you all to think about whenever you're engaging with potential partners. It's a very important part of your discussions that you should be having. For IV&V evaluations, our performers are expected to deliver bioprocessing technologies and training to the IV&V site so that the processing can be evaluated there. If so, at what time points would these deliveries occur, and would the device be returned to a performer? Yes, and referring you to section 3.3 in the BoSS ISO, which describes the programmatic metrics. It highlights the target months at which deliverables itemized in the following section 3.4 that describes the programmatic deliverables. So these time points are included at which you will share your stabilized cells for assessment, technologies that are developed, and an SOP, a standard operating procedure, with the IV&V. You will also read that these time points are about 2 to 3 months before the end of the phase to allow time for assessments to be made by IV&V. By the time the end of phase assessments need to be completed in order to assist with the program manager's decisions to either advance or down select performers. Specifically when it comes to bioprocessing systems in which instrumentation is very difficult to transport, understandably, we've built in an alternative method for IV&V assessments in which a member of IV&V would travel to your lab or company to do the assessments there at these critical time points. So this is why it's very important for IV&V to be completely independent from performer teams and carefully selected. I'll do one more question. Okay, cell type priorities and scope. Does BoSS prioritize allogeneic over autologous therapies, and is it better to demonstrate stabilization across multiple cell types at shallow depths, or one cell type with deep IND ready validation? So No, BoSS does not prioritize the cell demonstration systems. It used to assess the performance of the biostabilization technologies. Performers will be provided with 2 government-selected cell types to be used at the end-of-phase demonstrations, and these will be identified at the start of the performance period. But again, like I said before, you're not limited to the government-selected cell types. It is highly encouraged that you have a performer-selected cell type that would assist in your transitions, commercial transitions. So that's see one. Okay, I'll do another one for contracting. If milestone payments are tied to the metrics, will partial payments be allowed if most of the metrics are achieved? For example, if the team achieves every metric except one. So milestone payments are structured as fixed payments associated with the completion of defined milestones under the award, as long as a team makes a good faith, technically sound effort and can document credible progress towards the agreed milestone objectives. ARPA-H may approve the full milestone payment even if the originally anticipated technical results are not fully achieved. Any final decision regarding payment for a milestone will be made by the agreements officer in consultation with the ARPA-H program manager. Hopefully that answers a lot of your questions. Again, if it didn't, submit them through the portal using the QR code. Thank you. As we kind of bridge the gap before our closing remarks, we just want to clarify a few more things because we're talking to everyone and we want you to have a clear picture and a path forward to get your proposals in, right? We understand, I mean, this is ARPA hard, right? ARPA-H, but these are aspirational metrics. And please read the ISO. We keep saying that because 1, there were modifications that were posted Monday to clarify a lot of these questions that you all have. And 2, it has details in there that you may have missed the first time, you know? So all of these things are really important details that you need to have when you're finding your right partners, when you're defining your proposal and the metrics and milestones within it. I think there's a lot of confusion about the cells and what cell types to be used and what's going to be provided to you. It is really important for us that your technology gets to be adopted in the commercial setting. That is really important. It's really difficult to decide. You guys know this. You guys are instrumentationists, you're bioprocessing developers. It's hard to assess the performance of your developing system, right? And the most, I guess, fruitful way to assess the performance of your system is to look at its output, what some would call the device output, and if you're in a regulatory setting. So that's what we're doing here. The metrics were designed to be twofold in a way. You're assessing, so we can assess also the performance of your bioprocessing system. But also, too, we want you to be able to generate data during the program. It's paid for if you're awarded. You're generating data that could support future filings and comparability studies. All of these things are built in to support not only the output products that are the cell therapies that can be deployed out there, and the goal is to improve patient access, right? But we want to also be able to look and evaluate your technologies from a very objective standpoint. And that's why we have IV&V to also be our validation partner, right? So at the very beginning, we are going to contract with IV&V, and we're going to provide the cells to you that are government selected cells for free because we have contracted with IV&V. We are going to select 2 cell types. They're going to be commercially viable cell types. They're either used in the biomanufacturing setting as a starting material, a manufacturing intermediate, or a cell therapy product, or as others would know, as like a drug product, right? Still call that in the biologics world. Okay, but it is very strongly encouraged at the very beginning for you to find either you have a technology partner in mind, or you have someone in-house, or you are the person that can do the end-all be-all for your program, and you have cell therapies you've been working on, right? The teams are all going to look different. That's why doesn't seem very clear from a standpoint of putting this into some solicitation. Regardless, you need to start working on what you, if you are someone that is a cell therapy developer, you start working on your bread and butter, whatever cells that might be, right? In addition to that, which is the minimum requirement, you are going to be provided 2 cell types from IVNV. Again, we're going to select those 2 cell types. It's very likely that it's going to be a very therapeutically relevant cell type, right? We want success from all angles. So you will be provided 2 government cell types. Work on other cell types that are of interest and very translational, very commercially adoptable. So work that into your advantage. Start working on early. If the 2 cell types that you'll be provided on, work on them early on, figure out the kinks. IVNV is also going to provide you with SOPs on how to characterize these cells. Characterization of the cells is really important. They're based on these metrics that we've put in for stabilized cells. These stabilized cell metrics were very strategically chosen to, again, support the regulatory part of it when it comes to these products going into any kind of IND. So again, the SOPs, how to handle these cell types if you're not familiar with them. That's what they're supposed to help with. Familiarize yourself with these cells. You will not be culturing these cells. You will be restoring them back to a metabolic state as if it was, as if they were post-manufactured or thawed, right? So this is what we're calling in the ISO as a benchmark. These are metabolically active cells. And this will allow for your comparability when you have your stabilized cells and you reanimate them into a metabolically state. We want those comparisons. We want to see how good it is. It would be great if it's even better. Who knows? The possibilities are endless. I know that from today. And so if you have other questions, if I just wasn't clear, or maybe there was just too much information about the cells, please send in your questions to the FAQs. We're going to be keeping those updated and posting. But now I'll get back to some of the questions that were submitted today. Just a few. I know you guys are ready to go. Gloria is finishing up too, and she has a few closing remarks. The question that we got earlier was, what is the definition of functional potency and how will successful reanimation be defined at each phase? In a recovery period, if it's acceptable, and should potency be benchmarks against fresh cells or standard cryopreserved controls? The standard for today is cryopreservation. That's what we're trying to work against, right? So our benchmark has to be cells post-manufacturing, that's pre or before cryopreservation, or after thaw from cryopreservation, right? So both are metabolically active cells. So biological function or potency refers to cell attributes that are correlative to the proposed therapeutic efficacy or mechanism of action of a particular cell type. When metabolically active cells, again, before biostabilization and after reanimation. Reanimation refers to the approach used to reverse biostabilization. And this is really important that it has to be compatible and biocompatible, because ultimately we want the output of these technologies to go into humans, right? We want them to treat people. So it's really important that it's reversible biostabilization. Okay, and then the benchmarks of the metabolically active counterpart, again, the fresh cells post-manufacturing, pre-manufacturing and post-thaw, those will be provided by the IVNV partner, okay? And you actually, in your very initial stages, using their SOPs, will actually try to reproduce the same metrics that they gave you for those benchmarks. So, can you do it? And again, this is something that you will be doing for IVNV. You are going to be providing SOPs for them to perform the reanimation process, to do their assessments. And this is really critical, again, in the regulatory setting. This needs to be regarded as, usability, for other people when your technologies are deployed. It should be easily utilized. Human factors is a very real thing that stops people from progressing through the regulatory pathways. So again, we're building these in to all of the phases so we can have success. You can have success on your end whenever these technologies are commercialized at the end of at the completion of BoSS. I think I just wrapped up all of the questions into one answer because it's just about deployability. So again, our ultimate goal for ARPA-H is to accelerate better outcomes for patients, right? We want to improve patient access. And this is really great what BoSS is doing because it absolutely aligns with that. And thank you all for being here. I really appreciate all of your, enthusiasm. Excellent. Not only that, this is something that, is seemingly impossible, but now today with everyone here, it's really something that you can foresee as something tangible in the future. So that's really exciting. Thank you everyone online. We just need a few more minutes because we want those really important closing remarks from Gloria, and then we'll let everyone go because it's been a very eventful full day for everyone I know. But thank you again. Let's just take a few moments and then we'll conclude with today. Thank you.
Thank you to everyone here. I think we had a great day. I've heard about so many great technologies. I've seen teams coalesce. I love the ideas that are coming in. And I hope you believe, like I believe right now, I believe we can do this. So I'm excited that you stayed. I hope you got your questions answered. I hope you found your teammates. I did want to say one thing, remind you there's a new ISO out. So there's a modification that came out on Monday, and a lot of the questions that came in today I think are clarified in that modification. So please do go download it. It's redline where the changes are. There aren't a lot, but they're in a couple sections. There's a few little red lines that I think are really meaningful for you to take a look at. We recorded. The recording is going to go out. We've got the lightning talks recorded. Those are going to go out. So you'll receive those as soon as we can put them together and get them out. So thank you.